state-of-the-art mobile clinic.
We came to work because the death rates, mortality rates from Mode as a whole, because the health facilities are not accessible to our people, touched my heart. And that is why I came up with a hospital on the wheels called Mobile Clinic, so that we'll be able to move from village to village and treat our people. In the process of treating our people, we'll be able to make sure that our people do not patronize quack patent medicine dealers. And two, we should be able to make sure that our people have qualified doctors to treat them. And after treatment, they will be well. Then they will not have fake drugs. Fake drugs will not be made.
I have gone in, I have seen the facilities, and I'm very excited and extremely impressed that in addition to your normal legislative duties, which is basically to legislate for the good governance of Edo State, and that you'll be doing admirably well, supporting all our laudable projects, providing the legislative appropriation without which those projects couldn't be done. And in addition to those, you've chosen to embark on what can be described as a humanitarian project by using your resources to procure, obviously, a very well-equipped mobile clinic. Many of our rural people in particular still have difficulties accessing modern medical facilities. So I think your initiative is wonderful. It will afford you to take Medicare, not as they say, to the doorstep of those who need it in the most remote part of the local government. I'm sure the people will appreciate it. And for me, you've done us proud.
The Free Health Initiative is about health and no politics. In preparation for a successful exercise, she made several consultations with stakeholders of the various communities and qualified medical personnel and NGOs in order to assemble volunteers.
Is to assemble volunteers, assemble all of them. So they are going to work with this truck. But what I will be paying them is allowance, what they call allowance. For now, as long as I remain in that office, I will try my possible best to pay them. But however, I don't want politics in this. This is purely humanitarian.
On Wednesday, 16th October 2013, the Free Medicare Initiative commenced in Ewa, Isi North Ward 8 of Wode, with the official opening and kickoff of the exercise. With the Speaker, Edo House of Assembly, Honorable Uyi Ogogo Igbe, and his Deputy, Honorable Festus Ebeya, and other well-meaning Edolites in attendance.
To appreciate the Honorable Member representing Omude for her initiative in bringing this wonderful project of free health center, mobile center to the people of Omude. I want to say thank you very much on their behalf. I want to also say that the people of Omude did not make a mistake when they elected you to represent them. You are now showing what you are made of. As it is now, you have put some of us on the spot. We are going to have to look for projects that will touch the very masses in our various constituencies. Because this project is going to touch everybody in the constituency, especially the people that are in the very rural areas. I want to also thank the doctors and nurses who have volunteered their service here for free. I want to thank them very much. I want to say that God will bless them and continue to add to them. Having said all of this, I want to dedicate this mobile clinic to God and of course to the service of mankind. Thank you.
Since its takeoff at Ewa, the fame and the news of the hospital on wheels has grown, and the hospital has rolled across Obada, Ugiane, Gunoba, Ohe, Ideduma, Uhiwento, Urokosa, and Orwa, where Honorable Mrs. Ativi hails from, with Egba marking the end of the first phase of the free mobile clinic exercise. Visiting each community in Nwode, the medical personnel have never attended to a patient population of less than 200 at any location, conducting tests and dispensing free drugs and glasses, entertaining cases from the simple to the complex, which easily would have been taken care of if there were accessible, functional healthcare staff and facilities in all the local government area. With the Honorable Chief Mrs. Ativi's project, it's the dawn of a new day. The need to get more partners, NGOs, private individuals, corporate bodies, and the local government involved is all the more important to the already initial successful exercise.
Well, I actually think this is really a very, very good project. This is, I was actually more surprised because I didn't expect it to be this expensive. I think our people need more of this from their congressmen and the government and all the community leaders that have the money. There's no saying, the impact of this to all these people that may not have the chance to travel to Benin to see a doctor, or if somebody is sick, they cannot get care. We actually in the ENA believe that healthcare should be something that's free and accessible and affordable to all citizens of the state.
Because this is a project that is going to need partnering with. The Honorable Member, this is a constituency project. She has done this much. She's going to need support from the local government to continue to be able to put in drugs for the continuous use of the people, which is where the local government chairman is going to come in. So I'm happy that the legislative arm is here, the leader and the members, so that you can pass this message on to him. It is very important so that this dream doesn't die. Because if the drugs that are here now get exhausted, they are going to need replenishment. She has done her part as the member representing this constituency for the constituency project that she has brought here. It's now up to the local government to make sure that they keep replenishing the drugs whenever they need to be replenished.
The hope is for a sustainable program. If you join the magnificent vision of Honorable Mrs. Elizabeth Ativi through your kind donations, the intention is to continue the free rural health visitation twice a month for as long as possible.